Hello everyone. My name is Pedro, and I am an orthopedic resident in Portugal, and it is a pleasure for me to be a part of this huge congress. Here we have a study that compares conservative versus surgical treatment in the middle third clavicle fractures, and we want to give you our experience. As we all know, 80% of them occur in the middle third, and historically they were always treated in a conservative way despite an important percentage of pseudarthrosis. We have situations where we know that we have to go into surgery, like open fractures, skin tenting, floating shoulder, and neurovascular injury. But regarding to relative indications such as deviation and shortening, we still have some doubts. In our study, it was a retrospective one, and we included, of course, middle third fractures that came to emergency room between 2018 and 2020 that had more than 100% deviation and more than 15 millimeters shortening. We excluded people with less than 18 years old, open fractures, floating shoulder, and neurovascular disorders. We evaluated reduction, consolidation, functional results following constant Marley score, which is the most used in shoulder, and of course complications. Our population had a mean age of 46, which is all young and very young, and so they are the majority of them were male, maybe because of the mechanism during sports or car accident. We treated 63% of the patients in a conservative way and 37 with surgery, always open reduction with plate and screws. Regarding reduction, surgical group were almost always anatomic, and in conservative group, we had a mean of 14 millimeter shortening. Regarding consolidation, we had no problems with surgery and 15% pseudarthrosis in a conservative group, less than described in literature, but still an important number. For functional results, they were quite good in both groups, with the patient satisfied, but even here we had a little better in the surgical group. So finally, regarding complications, half of the patients in the surgical group had complaints with hardware, which is a huge number, but we didn't remove the plate in the majority of them. Also, 15% had supraclavicular hypoesthesia, and we all know how difficult it is to preserve those nerves. In the conservative group, we had those referred pseudarthrosis and obviously some complaints with tumefaction. So as we said, we accepted nowadays those relative indications to go to surgery because recent studies show they have better outcomes with surgery. But we still discuss this because conservative treatment has really good clinical results, even when it turns into a pseudarthrosis with the patient still functional. And of course, the conservative treatment, we have less complications and less costs. This image is from a patient we had in the last month. This is the initial X-ray, and we tried to treat him in a conservative way. For me, it was a little bit mistake because we have this third fragment, and so here you can see on the left an X-ray with 3 months after the fracture without any callus, and we decided to operate him. We took some bone from the iliac crest and we made an open reduction, internal fixation, and until now the patient is really satisfied. So, in conclusion, middle third clavicle fractures with deviation show less pseudarthrosis when treated surgically, with a very good functional result. And but despite that, the conservative treatment also has really good outcomes. Thank you for your attention. It is a pleasure to be here with you.